Hello, my name is Reggie Gilstrap, and this is my muscular skeletal assessment. It's just me, the student nurse. Provide for patient privacy and hygiene. Hello, Mr. Gilstrap, how you doing today? Awesome. My name's Joey. I'm going to be your student nurse for the day, okay? So today I'm here to conduct something called a muscular skeletal assessment. It'll probably take between 12 and 15 minutes. Is that okay with you? Okay, so before we get this started, I'd like to ask you a couple questions, okay? So can you tell me your name and date of birth? Awesome. All right, Talon. And do you have any allergies?
Nope.
No? Okay. The last thing that I want to ask you before we get this started is I want to ask you about your pain. On a pain scale of 0 to 10, 0 being no pain and 10 being extreme pain, what level is your pain right now? 0. Awesome. Okay. All right, Talon. So when it comes to doing the musculoskeletal assessment, the first thing that I want to do is I want to look at your gait. Your gait is kind of like the way you walk, okay? So if you can stand up for me and just walk to the end of the portion back. All right, go ahead, take a seat. All right, so with your gait, it was even, it was steady, and you have no use of assistive devices, okay? So your gait looked great. So now, the first thing that we're going to do when it comes to musculoskeletal is I'm going to assess your head, okay? So when I'm looking at your head, the first thing that I'm going to do is I'm going to inspect and palpate your temporal and mandibular joint, which is like right here where the jaws connect, the bottom and top jaw connect, right there, okay? So what I'm going to do is I'm going to touch you, okay? Is I kind of want you to move your jaw in, and, open and close, open and close. All right. Does that hurt at all? Okay. All right. So when it comes to your temporal, temporal mandibular joint, I didn't feel any signs of crepitus. You don't have any pain on opening or closing your jaw, so that's good. Okay. So the next thing that I want to look at is your spine. Okay. So there's a couple things that can go wrong with your spine: kyphosis, lordosis, or scoliosis. Okay. So what I want to do is I want to look at the curvature of your spine. So if you can stand up for me, and if you can face this way for me, I'm just going to palpate, which means I'm just going to touch all the way down to your spine. Okay. All I'm looking for is any abnormalities, any spinal processes that kind of stick out more than any other ones. Okay. All right, so that felt okay, okay? So what I'd like you to do now is I'd like you to bend over and touch your toes, okay? All right, so your body, your spine has a normal curvature. It curves like a C, okay? You can go ahead and sit back up. So it looked good. Your spine looks fine, okay? I didn't see any abnormalities with your spine. After your spine, I want to do your neck, okay? So with your neck, can you do me a favor? Can you look to the right? All right, can you look forward? Now look to the left. Now look forward. All right, now can you touch your shoulder with your left ear, right ear? All right. Now go ahead, and then with the left. All right. All right. Now lean forward and look up at the sky. All right, and look down. All right. Look up. All right. Now what I'd like to do is try to press against my hand. All right. Good. All right, and do it on the other side. All right. Good. All right. So your head, your neck, and your spine. I didn't find anything abnormal. Okay. Your range of motion was normal, was within normal limits. Okay. Your range of motion looked good, and your strength was. I'd rate it at a 5. Your strength was good. Okay. So that's it for your head, your neck, and your shoulder, or your head, your neck, and your spine. Next, we're going to do your upper extremities, okay? And what that includes is I'll do your shoulders, your elbows, your wrists, and then your fingers, okay? So with your shoulders, can you go ahead and stand up for me? And then face this way for me, okay? So if you can, with your arms, can you go ahead and from the side, just move them up? All the way up. All the way up. There you go. All right, then can you move them down? All right, now can you do that to the front like this? And down. All right. Now try to push up against my hands. There you go. All right. You can relax. Okay, so your shoulders range of motion and strength was rated 5 and good range of motion, okay? So next I'm going to check with your elbows. So if you can you go ahead and move your hand close like that? There you go. And down. All right, and do it with this one. And down. All right. And then what I like you to do is try to push against my hands. Try to flex like you're flexing, like you're trying to show off your guns. Come on. All right, good. And then now do it this way. Down. Pull it, push down. like this. Okay. So now, alright, so your elbows are good, okay? Your elbows have full range of motion, and the strength was rated 5, okay? And then let me go ahead and palpate your shoulders and your elbows to see if I feel any abnormalities, okay? Anything pushing out. Now, if this was real life, my patient would be not having clothes on. Well, he wouldn't have a shirt on. I'd be able to assess his skin, and I'd be able to actually see his joints. But for the purpose of this video, my son has a shirt on, okay? So palpating. Don't feel nothing abnormal. Next is your wrist, okay? So with your wrist, can you hold your hands out like this? All right, now can you, and down? All right, so now push against me. Try to push your hands up. All right, and push them down. All right, good. All right, so your wrist, good range of motion, and the strength is rated at 5, okay? Let's see. I don't feel any abnormalities in your wrist. All right, so next is your fingers, okay? Well, can you go ahead and do this for me? Can you go ahead and turn them up? That's called supination, and this is pronation, okay? All right, hold them up like this. All right, so now what I'd like to do is we're gonna do your fingers, okay? The first thing that I want to do is I want to palpate. You have a lot of we have a lot of muscles, not muscles, a lot of bones in our hands. All right, so there's a lot of area for something to go wrong in our hands, okay? So all I'm feeling for is any abnormalities, anything weird that's sticking out, something that doesn't feel normal, okay? All right. So everything feels normal. Okay, so with your fingers, can you separate them like that? Can you bring them together? All right, good. All right, so there's 2 tests that I want to do on your fingers, okay? The first one that I like to do, it's called a Tinel test, okay? And what the Tinel test is I'm just going to tap your finger, your index finger. I'm going to start with your index finger and go all the way up to your antecubital, right here in your elbow area, okay? And you're just going to tell me if you feel any tingling, okay? Any tingling? Okay, let's try it on this hand. Any tingling? No? Okay, so that's a negative Tinel test, okay? So that's good. The next one is called a Phelan's test, okay? And what I'm checking here is you're going to put your wrist together just like this, okay? And we're going to hold it for 1 minute. Okay, one minute elapsed. Do you feel any tingling in your thumbs? Any tingling anywhere? No? Okay. So what those tests are for is they test carpal tunnel, okay? And usually people get it when they use their hands a lot. But you showed negative signs, so no signs of carpal tunnel at this time, okay? So when it came to your upper extremities, I didn't see any signs of deformities. There was no edema. There's no bruises, no wounds, no inflammation. Bilaterally, range of motion was great, okay? Muscle strength was at 5, okay? So the last part that we're doing is your lower extremities. So this is your hips, your knees, your ankles, and your toes, okay? So with your hips, what I'd like to do is lay you down. If you can lay down for me. All right, and uncross your feet, and I'm just gonna palpate your hips, okay? And just tell me if it hurts, okay? Does that hurt at all? No? Okay, good. All right. So I'm gonna do a test on you, but I'm gonna say that test for last, okay? I'm gonna go ahead and move on to your knees, all right? So if you can stand up for me. All right. So with your hips standing up, if you can, let's see. All right. So can you swing your leg to the front and to the back? All right. And then show me if you can move it to the side. All right. Very good. Can you do it with the left leg? To the front, to the back, and then to the side? All right. Now you said it didn't hurt, right? Okay. All right. So next we'll go with knees, okay? So with knees, I need you to, let's see if you can you lean on this like this for me? So just face the camera and lean on it like that, okay? All right. And then flex your knee. If you can bring it to you. Okay. And then can you bring it back? All right. Can you do it with the left leg? Flex your knee. There you go. All right. So this is extension and flexion, okay? All right. So that looks good. So go ahead and lay down, and then I'm going to perform a test on you, okay? Well, first we'll do ankles. So lay down for me. I'm going to look at your ankles. I'm going to palpate. All right. Does that tickle? All right. Any pain? Okay. All right. So can you do me a favor? Like that? Can you move your foot to the side? Can you do that one? Do them at the same time. Move them inward. All right. And then can you do this for me? Kind of make the bottoms of your feet touch. All right. Can you face them outwards? All right. Very good. All right. No pain? All right. So muscle strength is a 5 for your ankles. Range of motion, full range of motion. I didn't see any deformities or anything like that. The next step we're going to do is your toes. Can you wiggle your toes for me? All right. Can you push down on my, all right, and then push up? All right, here, let's do them at the same time. Push down. All right, and up. Very good. All right, your strength is at a 5 there too, okay? All right, so the last thing that I want to do is something called a McMurray's test, okay? What I'm going to do is I'm going to take your leg. I'm going to kind of rotate your knee, okay? And bend it, and then go in and out. And you tell me if it hurts, okay? Does that hurt? All right. All right, and then we'll do this other leg. Does that hurt at all? No? Okay, well that's good. So you have full range of motion. Strength is at a 5. You can go ahead and sit up, sir. All right. So when it came to your musculoskeletal assessment, I didn't see any findings to cause alarm. Everything was within normal limits. You have good range of motion of all your joints. Your strength was at a 5 on all your joints. So I don't see any issues. Okay. Do you have any questions? All right. Your bed's in the lower lock position. The side rails are up. It's in the low position. You got your call light. Call if you need anything. Okay. Hand hygiene. Done.